All right, as the government shutdown drags on, the White House is shedding light on how dozens of criminal illegal migrants received Medicaid before their arrests and their deportations. White House spokeswoman Abigail Jackson telling Fox News Digital, quote, due to previously lax federal controls and Democrat state policies, criminal illegal murderers and rapists received Medicaid at the American taxpayer's expense. Joining us now is Administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, thanks for joining us.
Thanks, Ainsley. You know, the Democrats have been gaslighting us on this issue of Medicaid funds going to illegal immigrants for quite a while. When the president came into office, he insisted we take the fraud, waste, and abuse out of the system. And that's why the one big beautiful bill has provisions to do just that. The shutdown, as you know, is in part because the Democrats want to repeal that landmark legislation. And they keep claiming that there is no money going from Medicaid, an agency that I run, towards illegal immigrants. So we decided to do our homework. We sent our best investigators out to evaluate exactly what is going on. And I'm here to announce, Ainsley, and this is a big deal, that just over the last few months, we have proven that there's been over $1 billion. That's a billion with a B. It's a lot of money. It's not a rounding error. $1 billion paid by U.S. taxpayers for illegal immigrants in about half a dozen states. And we're just getting started. So it's going to be significantly more money than that. And just to break this down for everybody, Ainsley, if you live in Texas or Florida and you're paying U.S. federal taxes, most people do, your money is being diverted to places like California who have robust benefits for illegal immigrants, you know, dental, vision, things you don't even get on Medicare. And those funds we have no ability to track until today. Now we're investigating it, and we're going to continue to track this across the country.
So is that going to continue under the Trump administration? How can we stop this from happening?
Well, the legislation allows us to do just that. We are no longer obliged to pay for illegal immigrants in states that decide that they think are the largesse of their hearts. They want to fund those programs. If you want to fund full dental, vision, and robust health services in, for example, California or Illinois or New York or Minnesota, that's your choice. If you want to do that, you have to pay with your own state income tax. You can't use federal dollars for that. And so we are clawing that money back. Some of these states have already, they know they're guilty. They begin to pay the money back already. We will get all that money back into our federal coffers. The president is laser focused on protecting the U.S. taxpayer. But Ainsley, this raises a bigger issue. Why are we shut down? The people who should be doing these investigations, the folks who can solve some of the problems that we're having to improve the quality of care, for example, health care in this country, but many other services are being compromised by a shutdown that's based on false information. There is money being given to illegal immigrants on Medicaid. Again, Medicaid is designed for our most vulnerable, Ainsley. It's designed for our kids, for our elderly, folks who are struggling with significant health issues. They need those funds. You can't just dole that out to able-bodied illegal immigrants in states because they think it's the right thing to do. If they want to pay for it, they should pay for it.
Please send this memo, this study, to Chuck Schumer so that he sees what he's been saying, that they're not going to benefit, illegals are not going to benefit. That's not the case. We have the proof. Let's talk about MAHA, because Washington Post has this poll where there's bipartisan support from parents to crack down on processed foods and dyes and added sugars. But the MAHA movement is only getting 38% support. Look at this. Supporters of the MAHA movement, total parents, 38%, Republican parents, 62% like MAHA, Democratic parents, 17%, and independent parents, 34%. What is wrong? Why aren't we getting more support for MAHA when that's what it's all about, cleaning up our foods?
It's about cleaning up our food and cleaning up our environment. And to me, MAHA really is about just being curious. As you know, 80% of questions are really statements in disguise. And in MAHA, you want to actually know the truth. Are we having problems with these additives and processed foods and the like? I think the reason those numbers are low, Ainsley, is because a lot of Democrats don't want to acknowledge that the MAGA movement forced this country to answer big questions. And out of that came this concept of MAHA, which is to ask those tough questions about our food supply. I think moms across America know that we're making it hard to raise our families in a healthy fashion. So they deep in their hearts know this to be the case. They just don't want to use that phraseology. But you're seeing more and more folks, especially independents, but now Democrats as well, saying there's clearly been no one watching this process. Secretary Kennedy, who's been just fearless and tireless in his pursuit of honesty and integrity in these issues, is getting more and more folks to wake up to the reality that we've taken for granted our health. And the reason so many folks that you care about aren't doing well is that we have tolerated transgressions on basic things we would assume to be the truth, which is clean environment, clean food, and ability to go out there and be healthy, including, by the way, mental health issues that have risen in part because we've tolerated social media transgressions that are, I think, at this point, intolerable. Dr.
Oz, thank you so much. Great to see you.
Hey, Ainsley, one big question and one big promise to everybody. Today's is opening day for open enrollment. All this beautiful program of Medicare is something out there. If you haven't enrolled in Medicare, if you want to know more, go to Medicare.gov. One of our basics frameworks, our social safety net of this country. It's all there for you. Take advantage of it.
All right, opening day. Thank you so much.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.